Hi, I'm Dr. Castanet. I'm going to talk to you about a topic today that's not exactly related to the spine, but I've had a lot of patients ask me to do a video on this topic, and it's about exercise generally. When we talk about exercise, it helps to understand that fundamentally what exercise is. It's the contraction of skeletal muscle. And the benefits you get from exercise are proportional to the number of motor units, which are the units of fibers and the nerve that innervates them within every large muscle. The more muscle mass you use during the course of exercise, the more benefits it has, both in terms of metabolic demands, eliciting an adaptive response, which I'll get to in a moment because I think I'm going to assume there are certain rational and preferable objectives when you exercise, especially as you get older. But you have to understand you can use a reductionist method to evaluate the value and merits of any exercise by understanding that what exercise is. It is the contraction of skeletal muscle. Every exercise, whether it's soccer, tennis, volleyball, weightlifting, swimming, whatever, involves the use of certain muscles and certain number of motor units, depending on the physical demands, and a certain range of motion of the joints, etc. So it can all be evaluated and analyzed with regard to those basic fundamental parameters. So I'm going to make the assumption that if we're discussing what exercise to do and your preferences for an activity, for a certain activity, that's fine. But if you asked me what would be the most valuable exercise, then there's no question it's weight training. The reason is that weight training is not a single exercise. It is the purposeful, deliberate movement and contraction of a variety of muscles and joints, ideally through a safe but pretty full range of motion in a very purposeful way with sets, repetitions, etc. And with the objective being that a given outcome in and of itself, not as a byproduct of some other objective like chasing a tennis ball or chasing a golf ball or soccer ball or something like that. So if you just ask me about the intrinsic merits of exercise, as I said, the most valuable is weight training. And so, for example, when let's look at the arm muscle to be simple. The arm muscle, the bicep, you may use in a variety of sports. Perhaps you would use it a little bit when you're throwing a soccer ball, inbounding it, or maybe during a tennis swing, or perhaps with a dumbbell. With throwing overhead or swinging at a tennis ball, certainly there's some range of motion. The number of motor units is not intense. The metabolic demands are not that intense. When the activity is over, you haven't also elicited an adaptive response. So you finish the activity, you finished exercising, and you go about the rest of your day without any significant metabolic consequence or adaptation or benefit. When, on the other hand, you lift a dumbbell purposefully with certain objectives at eliciting an adaptive response, there are metabolic demands that continue after you leave the gym and that have great benefits, including the synthesis of muscle proteins, mitochondria, increased muscle mass, increased bone mass, and on and on and on. If you play tennis, and that's your means of exercise, you will, like everyone else does, degrade over time, and you will not have meaningfully done anything about the normal trajectory of aging and disability. People that play tennis are not going to maintain muscle mass. They're going to undergo the typical age-related sarcopenia, a loss of strength and muscle mass. That does not happen with weight training. With weight training, you would not have the same capacity at the age of, say, 70, 80, 90 as you did at 20, but you would still have an extraordinary amount of fitness and strength and ability, even relative to people that are 20 and 30 years old. So it's the only meaningful intervention you can make in this normal trajectory towards disability, weakness, feebleness, loss of bone mass, loss of muscle mass, everything you don't want as you age and degrade. So I just wanted to make that point about weight training. How to do it is a whole nother topic, broad topic, and there are many nuances to it. It's a great way to get injured, so you have to know how to do it. You have to be mindful to do it safely and strictly so that you don't get injured from the activity. But on its merits, it is the superior exercise. So if you're limited in your time and you need to be efficient about exercise, there is no question what should be hierarchically your most important activities, and that would be activities designed to strengthen your body and increase muscle mass and strength. If you like, there are further topics, further videos on this and related topics that I'm going to put on my YouTube channel. And if I can ever help you with back and neck pain, my number is 404-558-4015. Thanks very much. Bye-bye.